And now with moving to value-based care, you're looking at episodes of care and outcomes. You can't look at outcomes without that digital data. It's important to pharma. Pharma is always trying to get products to market quicker. Pharma used to have to take paper patient records off the shelf of hospitals, transcribe them into computers to see how their drugs were performing. Now with the digital data coming from the electronic medical record, they could live stream into these databases and get products, see how their drugs were doing, or develop them earlier, or recruit patients for clinical trials much easier. So pharma became a big customer area. So the TAM of digital health grew bigger. And then there was this big wave of self-insured employers. These are employers that, just what I just said, they take risk. They don't have a capitated arrangement with a payer. They're self-insured. And they're increasingly not happy with the solutions that they're getting from their third-party administrators and their brokers, and they're buying these digital health solutions directly. That's how Livongo grew, for example, helping employees manage their diabetes, etc. So that was a new wave of customers. So it wasn't just payers, providers. Now it's pharma, self-insured employer. And then now, as you know, we have a healthcare consumer. Back in the day when you and I first entered the workforce, there were no copays, no deductibles. And now, deductibles are as high as $8,000, $10,000 for a family before you even touch your healthcare. So people are going in droves online to take control of their healthcare. So direct-to-consumer products and technologies and companies were booming. So all of a sudden, we have all these new customers. We have this wave of new companies being formed. So what we want to focus on is we'll take anything from what we call commercial stage. We don't like to take product market fit risk because, it changes so much what the product market fit is. And what is the gotta have versus the nice to have? The priorities of health system CEOs and payers, and et cetera, changes. And you never know what's going to take. You never know what's, really going to hit the right moment in time and decision making. And there's a lot of hit and miss there. So we wanted to see companies with 4 or 5 customers that installed the product, no betas, no giveaways, that actually delivered those products. Customers paid for them. And we could, with our network, we could do a lot of stealth diligence. We could talk to customers that we knew either had the product or didn't have the product and go out and talk to them. And it was really a lot of that talking to customers that would guide us on these growth companies. And then as the companies grew, we knew we could help them a lot with introductions. We have this big, deep and wide network. We had a lot of experience building companies before, so we could impart some of that to them. And so, take them all the way up to, pre-IPO.